Somebody please call me and tell me.
General Hospital in Westmoreland is facing a severe overcrowding and staffing crisis. Health Minister Dr. Christopher Tufton says the situation is worsened by 29 social cases occupying the hospital. But he's expecting the situation at the hospital to improve in the next 2 months. Kimberly Petty has that story.
A yellow caution tape and erected steels, a clear indication that work is ongoing at the Savannah Lamar Hospital. The hospital's accident and emergency department was damaged during the hurricane, while the outpatient clinic was completely destroyed. In the aftermath of the hurricane, the facility is also battling several challenges, to include overcrowding.
In all of this, what we're having is overcrowding and overflow because the demand on the system is high and the facilities are actively under construction.
It's a new year, but the age-old issue of overcrowding persists. In 2023, the facility was struggling with bed spaces, which forced patients to sleep on beach chairs in the waiting area.
So currently the hospital has a capacity of 218 beds. It's now at 298, I'm told. And so between the main building and the field hospital, it's 298. So you can imagine that's much more inpatients than the capacity allows.
And while the already limited staff is trying to cope,
the situation is amplified by 23 social cases, 29 social cases. So over 10% of the beds are occupied by persons who should not be here.
And if that isn't enough, the hospital is struggling to get doctors and nurses to fill vacant positions.
There are staff shortages because there are over 20 doctors' posts that are not filled, not because we don't try to fill them, but we don't have the personnel to fill them.
Meanwhile, Dr. Tufton announced that by March, things will improve, and so he is appealing for patience from the Jamaica Medical Doctors Association and other stakeholders.
And I encourage the associations, the nurses associations, the medical association to work with us under the circumstances. I'm prepared to sit with them. I'm meeting with them next week. And that intention is to try to appreciate the concerns they have. Genuine concerns, no issues with that. But I also want them and all of us to understand the context in which we are placed.
You know that something, you know, when a dog is ashamed, the dog run away. When a dog is ashamed, when a dog feels shame, when they say move dog and the dog run, the dog leaves your presence. Mr. Tufton don't even have the shame of a dog to just step down, leave the ministry. You are incompetent, you are reactive, you have no vision for the health sector in this country. You've brought disrepute to governance in this nation. You've shortchanged the people of Jamaica, the children's future. You've done nothing but to upset and aggravate loving Jamaican citizens who wants the best for this nation. You have done a great disjustice to this Jamaica land we love. The black, green, and gold is bleeding blood because of this minister of health that they call Mr. Tufton. It is almost unimaginable that we could have a minister as incompetent as the Minister of Health. He doesn't care. He takes no accountability for nothing that happens under his ministry. It is embarrassing, to say the least. I'm going to be taking calls at 7:30 for those calling. No form of proactive leadership. And don't try to make it seem as if Melissa is the reason why a lot of these problems are happening. Many of these issues existed long before Melissa. Look at what is happening at the university hospital. Look at what is happening under your watch. It's always, you're going to do this, you're going to do that. No forward thinking, no innovation. Not even beds the places have. Shouldn't that be the bare minimum for any hospital to have beds? Bed? No, man. Ladies and gentlemen, I don't know. I don't think we are as concerned as though we should be. No. No. No, ladies and gentlemen. Let's really stop and think. Not even not even beds. At the emergency section, we're not talking. Listen to me, ladies and gentlemen. I am appalled. I am discombobulated. I am confused. I am bewildered. Give me another word. Give me another word. I am lost for words as to how we have descended to a place where good governance no longer exists. It doesn't exist. It's non-existent, ladies and gentlemen. Where is the good governance? It's nowhere to be found. But we saw the drill scandal. How much money in contract given to close associates of his? Now what is happening with the hospitals? They are in shambles. Sav shamble. Cornwall Regional Hospital shamble. The big scandal happening at the university hospital up there by Papin for so long, and he doesn't know anything about it. They never know anything about it. No accountability. You can't hold them up. Why are you there? You are literally doing more harm than good than being in that position. So I will continue to ask for the resignation if nobody else will step down, ladies and gentlemen. I am asking for the resignation of Dr. Christopher Tufton. And your doctorate is in what? Business administration. And I just want to clear the air. I don't want person to think that you're an actual doctor. Let's just be very, very clear as to where your doctorate degree is in. It's just go, man. My God. And if he was a good MP, ladies and gentlemen, I promise you this, I would cut him some slack. If he was a good MP, to try not make it look so bad, because me have a little, as a Christian, I try to, understand me, I say, me try not make things look so bad. But if he was a good MP, ladies and gentlemen, it would have bad and not so bad. But the man is a disgraceful member of parliament. The taxi operators had to protest to see the road get fixed. It has been in a sad and sorry state for so long. And when the people had to protest, that's when they quote unquote fix it. Because as soon as them fix it and liquor rain fall, right now it's digging up. There's no vision for the young people in his constituency. No youth involvement. No innovation. No nothing. You don't even have a 6-a-side football team in the community. Not even a little netball team for the girls. No community spirit. No nothing to uplift the place. The infrastructure is poor. I have never heard him as an MP represent his constituency in parliament. Never. Never. And I'm saying, ladies and gentlemen, this is the most disgraceful thing I've ever witnessed in all my entire years of existence on this earth. The Jamaican government system is at an all-time low. It is the worst we have seen it. The blatant corruption, it has become unbearable, and the people are suffering. But that is the only result, that can be possible when the head of the stream is corrupt.